A woman is a mystery and a wonder. A woman's body is a bigger mystery. In the series of women's healthcare here on Aware and Care, we are talking about women's health. In the last couple of episodes, we've got tremendous feedback from all our viewers. We appreciate your feedback and your inputs about what topics we need to pick. We're talking about women's body as a mystery. Something happens, it is a good thing. Something doesn't happen, it is sometimes a good thing. But something stops, it brings a lot of concern. Today, we're going to talk about menopause. Let's welcome Dr. Ambika Nair, who's the co-founder and chief consultant at Santhigram Group of Companies. Namaskaram, Doctor. Welcome to Aware and Care.
Namaskaram. How are you?
All very good, Dr. Nair. In our series, we've been talking about women's health, and the last couple of episodes, we've spoken about, when the periods start, when the periods stop, what is happening. But now we come to a point where we are a little concerned when a woman has reached middle age and her periods have become erratic or they are stopping. So let's talk about menopause specifically and first try to understand in today's times, what is an expected range of age that menopause is expected?
Okay. Our Rajas means our menses. Nivritti means is stopping actually, the Kala. So this is that Rajo Nivritti Kala. So it is ending because our glorious time is coming back. It's a golden time. Everybody enjoys their silver time. This is our golden time. So that's like normally it's a good question you ask me and very good topic also today. So the age is, it depends upon the whether how stressful that person is, whether like any other disease she has, any chemotherapy she has taken, or any other disease she is treated with, because this all depends upon the age. But normally it comes, it starts from the age of 40 and continues like 4 to 10 years.
Wow.
But some people, like it goes even till 60 years and they won't even know. But in certain cases, I have seen that, like a premature menopause, like 33 and 35, 36 and all very common these days. I think because of the, stressful life what they are leading. That is also one of the causes actually. Yeah.
So you're talking about something very early in the mid-30s to ranging in 60s. There is a possibility.
Yes.
Traditionally, we used to assume that a woman who reaches 50 or 45 plus, then she can start expecting at some point for the menopause symptoms to come in. Well, talking about menopause symptoms, I think that's one of a very, very popular topic for women above 45 or who are having something to do with menopause. So just give us a rough idea as to what exactly the symptoms. I know there are a lot of them, but what are the symptoms that should be of major concern to our viewers who are in this phase, and symptoms which they can take very easily or comfortably?
Okay. First of all, that awareness is not there about menopause. Only the internet reading, like somebody will tell, oh, this will happen, that will happen. And you can, but it all according to the constitution of the person. First of all, how it happens is that our ovaries will stop functioning. Like it will start like a lower, like a release of estrogen and progesterone. So naturally, the person will feel, like, oh, till last month, my periods were regular. I was perfect. My weight was very good. And now you see, I have put a lot of weight on my tummy. My period was less. Okay, so that is a scanty period. Okay, so they will tell like that, like erratic headaches, and their sleep will be disturbed. Their mood swings. Blood pressure goes high. Some people, if it is kapha related, what will happen is they will put a lot of weight, like the fluid retention in the body. When you, on examination, you can find, that there is edema on the, legs and all. And even they will, first of all, they will tell, their hands will become, I ask such silly questions to them. Like when you get up in the morning, your ring become tight. They will tell, yes. Okay. Then, so we understand that it's otherwise, you ask them whether they have fluid retention, they will never agree for that.
Yeah.
So you should have, you should be aware that what you're asking, question should be a little tricky. Then, because they will get into constipation, sleep will be disturbed, their mood swings, they get so angry very fast without any reason. They will tell that because I didn't want to get angry like that, but it happens. So it is not under their control. Some people will overeat a lot. Some people has any, like anorexia, like loss of appetite, nauseated feeling, urinary infection. Like when they cough, they tell that there is, like a release of urine in that at that time. And some people will get some pelvic inflammation, like a heavy white discharge or anything, like some other, like a low grade fever and all. But this all with other diseases. It's not along with that. Dry skin, mind is running. They have like aggravated vata. So much of, like then you can see their blood pressure varies a lot, palpitation, like excessive sweat. Their pulse rate will go very high. So there are
Doctor,
so many
you're mentioning so many symptoms here, and you just mentioned
more coming. Don't worry.
you just mentioned about hot sweat. So that is the only
Hot
thing people
flashes.
are talking. Hot flashes. That's the only thing people are talking about. And there's so
But
many
no,
symptoms.
no, no. When they come in front of you, they will tell, my pulse rate goes very high. Doctor, itna anxiety ho jata hai, they will tell, like I start fluttering of my chest. That not only that, they will complain of numbness in the whole body, burning sensation in the foot,
Wow.
burning sensation in the hands, eyes burning, eyes are burning, eyes are burning, eyes are burning. They will be complaining like that. Whole body like that. Some people will feel so cold. Some people cannot, go near the heat. So it is all
Either
according to the
they're too
constitution.
hot. Okay.
Yeah, they will. Yeah, this is all according to the constitution. That's what I'm telling, because like it is not like in nutshell, like, but nutshell what I'm telling, like, because or that's why, like after the menopause, you can see the ladies, they will look different. The wrinkles will come, all those things. Okay, so how? Because the estrogen level is very low. That's the thing.
So I think before we continue, I think I should correct myself rather than saying that this is a women's health awareness episode. I think most men should also watch this to understand what's happening to the women.
Yeah, coming in that. Okay. Then, like some people will complain of like, like dysfunctional uterine bleeding.
Mhm.
Some people will have no problem at all. They will have an easy menopause. They will
Wow.
tell, I never even knew when it stopped. So, like, like so many, like mind related things are more actually, because they feel that they are left alone, that
That
they
was my
feel.
next question, actually. You talked about all these physical symptoms here. Let's also talk a little bit about mental situation. What happens to the mental health of a woman who's going through menopause? Is she happy, or is she like, okay, finally I'm done with this chapter, or it makes her feel a little inferior? There are lots of talk which happens. So what is
No,
your
actually, like, because we will tell, because the husband and wife comes, I always tell that without your help, we won't be able to, help your wife.
Mhm.
So they need the support actually, mental support,
Okay.
because what she is undergoing, the whole family should understand. There is nothing, like no secret nowadays. What
Mhm.
is menopause and all. So before it was a secret, she is like that, she is like that, we can brand them, but it's not like that. It's a medical issue, you understand.
Mhm.
So what, so that grihasthashram, like we are like getting into vanaprastha. So you have to prepare your mind. First of all, we have to make them understand that this is very normal in every lady. Some people will have more symptoms, some people will have less symptoms.
Mhm.
Like you can see like a very thin, like a vata related, vata kopa, vata prakopa means then they will be so restless. They get anger, for every small things, they will get angry like that. Dry skin, you can see the in certain people, like a hot, like you can see all the blemishes and skin diseases because of the high vata.
Mhm.
So we tell them, like how to go with that and how to take care of that. More, like a counseling is also needed.
Mhm.
Counseling of the husband is needed than the wife.
Okay. Doctor, before we move to the next part of it, I also want to little touch base here because you did mention about hormones, and it's all about the hormones. But there are women out there who have also gone through hysterectomy and their ovaries are intact, so their hormones are still functioning. So they do also face the same symptoms when menopause is hitting them.
They feel the same symptoms actually, but only thing, that uterine bleeding will not be there, but they will also feel the, like a low libido. You understand?
Mhm.
and like breast tenderness will be there, vaginal dryness will be there.
Mhm.
This all will be there with them also.
So, is this a condition which needs medical attention? Or when you say that
E-
everybody goes through this, so when should a person actually reach out to a doctor?
if the patient is having this bleeding for like like 4 to 6 months, and if it is exceeding two
Mhm.
years, some
Mhm.
people will tell that like 4 year, 5 year I was bleeding like this only. Then
Mhm.
they can, because that's a very big medical condition. Sometimes there can be fibroid in that, or
Mhm.
any other like cancer or anything like that. Any other disease can be there. So clots will be there. They can become anemic,
Mhm.
they can collapse. So they should absolutely they should go to the doctors.
So, only for bleeding should they come to the doctor, or are there any other symptoms which you feel that also needs medical attention?
If the sleep is not there for a long time,
Mhm.
even with all the home remedies, whatever they do, they all will Google and see how to go with that. Because 90% are like IT professionals, you understand?
Yeah.
So they will tell, like, oh, I did everything, doctor, but I could not actually come out from this. I get palpitations. This anxiety is another problem, because they feel their confidence loses, that they were very good. They will tell that I am unable to focus now. My memory has gone bad, because the estrogen comes down, mean it affects the memory also, like so kapha related, little bit, confusion in the memory. So all these things will happen. So the mind is also a big culprit in this.
Absolutely.
And they started putting on weight. Some
Yeah.
people will become very thin.
Mhm.
Yeah.
So, doctor, what is the considerable time to understand that the person has just gone through menopause? How much of absence of period would you consider that the person has hit menopause? 4 months, 6 months, 1 year?
Madhavi, menopause may not happen to some people. What will happen that, because they will get like a spotting little bit.
Mhm.
Okay, so like 2 3 months, little bit of spotting. Okay, then like some people will get like once in 3 months, once in 6 months,
Mhm.
once in 8 months. So that is a graceful period of like a menopause. Okay, but they will not have any other much bad symptoms like what we are talking. So
Okay.
that is very graceful actually. Otherwise, because then they know that, because they are like 48. Some people will tell that 52
Mhm.
or 55 and all.
Mhm.
So they won't have any other issues. Like some people will complain of more of bloated abdomen.
Mhm.
I feel so breathlessness. I get bloated abdomen. My thighs are burning. My thighs are paining. My calf muscles are paining. I can't walk. Like so many complaints will come. Different constitution experiences a
The body
different
is
way.
different.
Like this. Yeah, symptoms actually. But some people are very good. They will try to adjust. But some people cannot, because it goes out of way.
Mhm. So today, friends, we are talking about menopause, and I think in the last couple of minutes, what we've almost covered is the symptoms. They range from all the symptoms that you can think in the world that is there with the women. And what requires more is, like Dr. Ambika Nair just mentioned, counseling is also there. And if your female friend, family member who's going through these kind of symptoms, it is always good to approach the doctor and understand if the lady is going through menopause state. It is considered normal, but some things are not acceptable. Doctor, do women also get a chance to get pregnant during this time? Have you seen any cases where they think they are in menopause?
I have seen, like no period was there for like 5 6 months, then
Mhm.
they become pregnant, like 49 and all.
So they still have to
So that,
continue their birth control.
yeah, they have to that actually. Yeah, they have to take precautions. I won't say they have to take birth control pills.
In whatever is the forms is comfortable to the person.
Absolutely,
They
absolutely.
also
Yeah,
continue with that.
yeah.
So there is also a possibility that a woman who's going through menopause can get pregnant. So that is a very important piece of information Dr. Nair has just mentioned. So, doctor, somebody with menopause and so many symptoms has come to Shantigram. Let's help this woman and understand what she needs to go through in the treatment.
Okay. So first of all, I will do the pulse analysis,
Mhm.
whether it is through the Zoom or which is I can do it through the Zoom also. Okay, there's no problem. So I will see whether it is kapha related, whether it is vata related, whether it is pitta related. Okay. So if it is kapha related, we see that, what the patient has to take. Like we will give the diet, we tell them, like we see the nails, whether they have any joint pain. Stiffness in the joints is another symptom, big symptom actually. They get into, like osteoporosis. This is the time. If you don't take care, only that will happen actually.
Mhm.
Okay. So we tell them, what, like whether it is related with the more hormonal issues, so the diet will be given accordingly that.
Mhm.
Then comes, because what, like a depletion of calcium and it will get into the bones. So what diet they should take. So I will
Okay.
tell about continuously like that.
Mhm.
Okay. Whether it is with pitta, what they should eat, what they should not eat. We'll see that how is their sleep, their mental status, whether they are getting depressed or not. Depression all comes under kapha, more
Okay.
kapha, but here aggravated because they will be very impatient and they will be very restless people actually.
Okay.
So it is like, during the menopause means mostly people are like pitta and vata. Okay. Even though it is a kapha and pitta disorder, aggravated vata will be there if we don't take care at the time.
Mhm.
Okay. Then, like we will tell them what to eat, what not to eat,
Mhm.
according to the constitution.
Mhm.
So, like deep fried food for the kapha people, sugar they should reduce,
Mhm.
and more, like basmati rice is good actually, and the, like the tofu is very good.
Yes. Doctor, most of the women, of course, because the hormones are not producing what it needs to produce, it affects the skin. And appearance is a very important part of our social life. Are there any medications also for that, or do some
Yes,
women also take replacement therapy? Do you
yes.
recommend that?
So many, so many people will come. They will tell they will have estrogen patches. They
Uh-huh.
will be taking birth control pills. So then they will have so much of other complications with that they come to me. Like if needed, we tell them to go for the, panchakarma therapy.
Mhm.
Otherwise, like see in pitta cases, in some of the pitta cases, we tell them no sleep, no sleep, no sleep. Then, we have to give them Shirotharya, Abhyangam, because Abhyangam will improve the circulation. Circulation is needed. So that will help them to be out from the osteoarthritis and all. Okay, because actually, normally during the menopause only all these diseases comes. So they become like a everything pre-diabetic, like their blood, like you can see them, if they are kapha, more oriented kapha and pitta, you can see their digestion is not okay,
Uh,
and they will have like hyperlipidemia, like cholesterol, especially triglyceride. So whatever they eat, it should digest and assimilate. So if the absorption is not proper, means they will put a lot of weight.
mhm.
Okay, so all these things we tell them in very precisely. Then if they cannot come for the panchagama, we give them oil so that they can do abhyangam at home. Abhyangam means whole body massage
All
with a
right.
specific oil. So that
Mhm.
oil and all, because according to the constitution, which prakriti they are, we tell them like that.
Mhm.
Okay. Then like what they should avoid, like I was telling you. Then again, what they should eat, the wholesome food, fruits include, like mushrooms they can eat, all the nuts are good for them, raisins are good. There are so many good fruits also, but if they are kapha, we tell them not to eat any banana and grapes.
And what about water? Intake of water is
Water,
increased
the
during menopause?
intake of water, it is always like how much. If they are like 150 pounds, means half of the, like half they should take like water. Okay, they should consume water. So that much is enough. But see that urine is also passed properly. If not, like if any dysuria or anything like that, then we have to see. Some people will have a problem in passing urine also.
So
Yes.
many symptoms in this mysterious body and a beautiful body, and people call her the woman, and she has to go through so many things. But nevertheless, with support and love and affection and right medicine, things are possible. Now, we spoke about a woman who is going through the phase of menopause. Let's also talk about a woman who has officially been declared that she has got menopause. What is the care she needs to take care of her body after menopause?
After menopause, they will tell, like a whole body pains. Okay, stiffness in the joints.
Mhm.
My whole, like a pin pricking. Some people will tell like that. If like that, they should, like they should do abhyangam.
Mhm.
Whether they have 2 minutes, 5 minutes, take care of the body a lot. Otherwise, the skin will become very dry. You will look very old, which you will not accept.
That is where the all the root cause starts coming from. And like I
Okay.
said, a man is a
Yes.
human, a social being. So we're talking about women also who've just gone through menopause. You're talking about joint pains and bones getting brittle. Any other symptoms that you feel, or anything
Nail
you
brittle,
think that they should take care of after menopause?
hair falling will be there.
Mm-hmm.
Tremendous hair falling will be there. And brittle nails. Of course, we can cover. There are so many ways artificial nail is in this, but like people like their own natural hair. So like oiling of the hair. There are so many for the board until there are so many good herbs available in Ayurveda also with no side effects and all. So they can come and they can they should seek the doctor's advice, not
Nice.
like buying hair, nail, and skin.
Yes. So you have mentioned so many remedies here, support functions when a body is getting prepared towards menopause, and also support diet and support functions when she goes through menopause and comes to the other stage. I want you to convey a message to the family and the entire support function out there. People are in so many of professional lives, professional work is there. Every moment, different age groups. Somebody is going through different stages of menopause. I want a message from you to all our viewers today, especially to the men and to the young generation. What to do when you feel that a person is going through menopause?
We all need the family support. Without support of like even good friends are there, they will always see a conversation, explaining yourself. That is more like important actually.
Mhm.
Like convincing and consoling them. That's more like that will make them much better. They will people will come and tell, there's nobody to talk at home, doctor, so that's why I want to talk to you. See how much time we can give, but I try to give the maximum time. Okay.
Mhm.
So the children also should understand whether it is boy or girl. Like they should understand your mom is undergoing certain medical issues which need your attention. That is more important. So your love and care will definitely will help your wife, your mother, your sister to be again back in her golden, like era. That's more important.
Uh, Doctor, one more aspect I would definitely like to touch base is about exercising. Many women think that they want to change a lifestyle now, just start off everything new. And they go into extreme exercises. And that's when they realize that their bones have become brittle. So, what is the steps to understand that your lifestyle need not completely change, but it has to be gradual, especially to take the bones?
When you're undergoing, because this is that, like awareness, what we make them understand.
Uh-huh.
So exercise is a must, at least 15 to 20 minutes. Pranayama is very good, and eating habits, no overeating, light food. It is better to, see which will digest in you, which will make you healthy, you should eat.
Mhm.
Whether it is fruit, cereals, or, like any vegetables. You should see that, like otherwise, what will happen? You will fall sick. So many people will come and tell they have like hemorrhoids after this because of severe constipation.
Constipation.
Yeah,
So those were
that is
some
more.
very wide range of symptoms and great information that you've given. But what I try to understand from this conversation is a woman going through menopause is equivalent to a woman who's pregnant. You have to take care of her as you're taking care of a pregnant woman because all
Yes.
emotional and physical changes are just the same. But there she's delivering a baby. Here she's delivering a new self. Uh, Doctor, your final message to all our viewers in this beautiful episode on menopause and awareness.
And like eat, like leafy vegetables a lot. All our Indian vegetables are very good. That you should all eat, and include 1 teaspoon of normal ghee in the food. That's more important. Okay, you all can have like rice, but little quantity. Even quinoa is good, so that you don't like you put on weight. If you want to maintain your weight, that's more important. But so for Vata people and all, like you should use more ghee, and you should eat more cooked food, because otherwise the grace, the ojas will go away. Your tejas only will deplete again. That is also another important thing. So like restlessness, all those things will come.
This is a beautiful episode we've had. Thank you so much, Doctor. And before our parting note, I do want to check with you one more time because the wave of coronavirus is again spreading and we have so many advisories there. So your advice to our patients who are planning to visit you and the consultation.
If you are coming with the COVID report, if it is negative, I will see you in person. Otherwise, we can do the Zoom call, which is same way, there is not much difference. But only thing you will get the satisfaction when you see me in person. That's all.
That is so true. Thank you so much, Dr. Vika Nair. Always a delight to be talking to you. I look forward to the next episode here on Aware and Care. Namaskar.
Namaskaram. Thank you so much.